Have you ever felt like your body is sending you signals that you just can't figure out? What if your kidneys were trying to warn you of a serious problem, but you didn't even notice? Kidney disease is one of the fastest growing causes of death worldwide. And here's the shocking part: 90% of people with kidney problems don't even know they have them. Your kidneys could be silently struggling, and by the time you notice, it might already be too late. But here's the good news. Your body often gives subtle clues that something is wrong, and in this video, we'll go through 7 strange signs that your kidneys might be crying out for help and share easy tips to keep them healthy. Whether you want to protect your kidneys or help someone you love, this could make all the difference. Let's start with the first one on the list: dry and itchy skin. Dry or itchy skin might seem just an annoyance, but it could be a red flag for kidney problems. When your kidneys fail to balance minerals like calcium and phosphorus, or filter waste properly, it can show up on your skin. This can lead to persistent itching, which may range from mild irritation to severe, unbearable discomfort. In some cases, the skin may develop a yellow or brownish tone, which dermatologists often recognize as a sign of chronic kidney disease. Unlike ordinary dryness from weather changes, this type of itchiness doesn't go away with moisturizers or over-the-counter medicine. It can even disturb your sleep or make it difficult to concentrate during the day. If this symptom is paired with other warning signs, it's a strong indicator that your kidneys might be struggling. Number 2, fatigue can be a sign of kidney trouble. This isn't your typical tiredness after a long day. It's persistent, deep exhaustion that doesn't go away even after rest. When your kidneys aren't working, toxins build up in your blood, leaving you drained. But it's not just toxins. Your kidneys also produce a hormone called erythropoietin, which tells your body to make red blood cells. When kidney function declines, so does the production of this hormone, leading to anemia. Anemia means your body isn't getting enough oxygen, which affects your muscles, brain, and overall energy levels. This combination of toxin overload and reduced oxygen delivery creates a persistent feeling of weakness. Everyday tasks like cooking, walking upstairs, or even focusing on a conversation can feel overwhelming. If this sounds familiar, and you've ruled out other causes, it's worth discussing with your doctor. Recognizing this as a potential kidney-related symptom can lead to early detection and treatment, helping you regain your energy and protect your overall health. Number 3, shortness of breath. Feeling out of breath, especially when lying down, can be linked to your kidneys. If they're not working properly, fluid can build up in your lungs, making it harder to breathe. This condition, known as pulmonary edema, creates a sensation of drowning or suffocation and is especially noticeable when you're lying flat. Another factor is anemia caused by kidney problems. Without enough red blood cells to carry oxygen, your muscles and organs struggle to function, leaving you breathless even without physical exertion. Shortness of breath can make simple activities like walking or climbing stairs feel like a challenge. While this symptom is often associated with heart or lung issues, it's essential to consider your kidneys as a potential problem, especially if it's accompanied by other signs like swelling or fatigue. Number 4, swelling. Ever noticed puffiness under your eyes or unexpected swelling in your ankles, feet, or hands? When your kidneys aren't filtering fluids properly, excess water and sodium can build up in your tissues. This swelling, called edema, might be your body's way of signaling that something's wrong. The puffiness under your eyes is particularly telling because it's often caused by leaking protein from your blood into your urine, a potential sign of kidney damage. Swelling in the legs or feet can make it difficult to walk or even fit into your regular shoes. While swelling in your hands may make rings or bracelets feel tighter, sometimes this swelling may come and go, but persistent or severe cases can significantly impact your daily life, making it hard to perform even basic activities. It's also worth noting that swelling could worsen throughout the day as gravity pulls fluids downward, especially if you're on your feet for long periods. While swelling can also be linked to other health conditions like heart or liver disease, unexplained or consistent puffiness should prompt you to seek medical advice. A healthcare professional can perform tests to determine if your kidneys or another organ might be the underlying issue. Acting early can prevent potential complications and give your kidneys the support they need. Number 5, Changes in urine. If you're waking up multiple times a night to pee, struggling to pass urine, or noticing unusual changes like foamy or bloody urine, it's time to pay attention. Urine is one of the most direct indicators of kidney health, and changes in its appearance, frequency, or volume can tell you a lot about what's happening inside your body. Frequent urination at night might mean your kidneys are having trouble concentrating urine, which often happens in early stages of kidney dysfunction. On the other hand, a noticeable decrease in urination could point to a severe kidney problem or a blockage in your urinary tract. Foamy urine is another key warning sign. If the foam resembles the bubbles you'd see when scrambling eggs, it might indicate that protein is leaking into your urine. This condition, called proteinuria, or protein in the urine, often indicates that the kidney's filtering units are damaged. Blood in your urine is equally concerning. Whether it appears bright red, brown, or tea-colored, it can indicate issues ranging from kidney stones to serious infections or even kidney tumors. Some people might also notice a strong or unusual odor in their urine, which can be another sign of infection or imbalance. It's not just about appearance. The experience of urination matters too. Pain or a burning sensation while peeing could suggest an infection or a kidney stone. Feeling the urge to urinate but struggling to pass much could also point to a blockage. These changes can seem minor at first, but they're often your body's way of signaling a deeper issue. Don't ignore persistent changes in your urination patterns. Consulting a healthcare professional can help diagnose the cause and ensure timely treatment, potentially preventing more severe kidney damage. Number 6. Trouble sleeping. Having trouble sleeping may not seem directly connected to your kidneys, but the link is stronger than you might think. When your kidneys aren't functioning well, toxins that would normally be filtered out build up in your bloodstream. This accumulation of waste can disrupt your body's natural rhythms, making it harder to relax and fall asleep. You may find yourself waking up multiple times during the night, feeling unrested, even after what should have been a full night's sleep. Another complication linked to kidney problems is sleep apnea. This condition causes your breathing to stop and start repeatedly during sleep, often accompanied by loud snoring or gasping for air. Sleep apnea doesn't just disrupt your sleep cycle, it can leave you feeling chronically tired and even worsen kidney function by putting added stress on your cardiovascular system. Poor sleep quality can create a vicious cycle as it further strains your kidneys and contributes to overall fatigue, which we've already discussed. In addition to toxins and sleep apnea, restless leg syndrome can also be associated with kidney dysfunction. Restless leg syndrome creates an uncomfortable urge to move your legs, especially at night, preventing you from falling or staying asleep. This condition is often linked to an imbalance of iron or other minerals, which can be affected by kidney health. If you've been struggling with persistent sleep issues, whether it's difficulty falling asleep, staying asleep, or waking up exhausted, it's worth considering whether your kidneys might be playing a role. Addressing these underlying issues can help improve your sleep quality and support your overall well-being. Number 7. Bad breath and metallic taste. If your breath smells bad or you notice a metallic taste that makes food unappealing, your kidneys might be struggling. This happens when toxins like urea build up in your bloodstream, a condition called uremia. Uremia not only affects your sense of taste but can also cause a constant metallic flavor that lingers, making even your favorite foods taste off. Persistent bad breath, often described as ammonia-like, doesn't improve with brushing or mouthwash, and this can be a red flag for kidney dysfunction. Over time, uremia can also lead to nausea and even vomiting as the buildup of toxins overwhelms your body. These symptoms often go hand in hand with a reduced appetite, further impacting your nutritional intake and overall health. It's not just your mouth that's affected. The overall digestive process can be disrupted. Food may lose its appeal entirely, and some people may experience unexplained weight loss as a result. While bad breath and taste changes can be caused by other issues like gum disease or certain medications, they should never be ignored if they persist or are accompanied by other kidney-related symptoms. Seeking medical advice early can help identify the root cause and potentially reverse the damage before it becomes severe. You probably don't think too much about your kidneys, but these two small, bean-shaped organs are absolute powerhouses. They do far more than just filter waste. Every day, your kidneys filter toxins and excess fluids from your blood, keeping harmful substances from building up. They also regulate essential minerals like calcium and sodium, which are crucial for strong bones and healthy muscles. And that's not all. They help control blood pressure, produce hormones that support red blood cell production, and activate vitamin D to keep your bones strong. But when your kidneys aren't working properly, every one of these vital tasks can be disrupted. This can lead to high blood pressure, fatigue, weak bones, and even life-threatening complications. That's why it's so important to know when something might be wrong and why early detection matters. Kidney disease is often called the silent killer for a reason. In the early stages, you won't notice obvious symptoms, but by the time you feel something, up to 80% of kidney function could already be gone. That's scary, but here's the good news. If you catch the warning signs early, you can take action to protect your kidneys and avoid serious damage. Simple steps like regular checkups, paying attention to your body, and acting on subtle signs can make a world of difference. Protecting your kidneys doesn't have to be complicated. Here's simple steps you can take. Stay hydrated. Drink 4 to 6 glasses of water daily. It helps your kidneys flush out toxins. Warm water can be particularly effective in reducing waste levels. Exercise regularly. Activities like walking, swimming, or cycling can help manage blood pressure and improve circulation. Monitor risk factors. If you're over 60, have a family history of kidney disease, or were born with low birth weight, consider regular kidney function tests. Manage blood pressure and blood sugar. Keeping these under control through diet, medication, and regular checkups can significantly reduce your risk of kidney damage. Your kidneys are vital to your overall health, but they often give subtle signs when something's wrong. Recognizing symptoms like swelling, fatigue, or changes in urine can help you take action early and avoid severe damage. Take your kidney health seriously. Stay hydrated, stay active, and listen to your body.